Aaron, looks like we have four people, right? Four members.
This is Kelly. Yes, that's what I show.
Okay, thanks, Kelly.
Good morning. Can you hear me now?
Yes.
My apologies. I had sat on my mute button. So this is Erin with the Department of Medicaid. It's just now 9 o'clock and we're clearing the waiting room. So we'll give it just a few minutes. I believe I saw Steve, Casey, Van, and Kristen log in. Did I miss anyone else?
I don't think so. That's who I have.
Okay, we'll give it just a minute.
Is that Angela Darcy on?
Yeah,
Hey, all
it's me.
right. Glad you're here.
Glad to be here. I'm driving, so just ignore me. I'm going to mute myself until I have to a
Okay.
second or anything like that.
It looks like the waiting room is clear, Steve. I think you need one more for a quorum, so I can keep an eye out, excuse me, for any members that join. It's about 2 after, so
All right,
I
let's
can.
go ahead and get started. Who do you have that's on from the?
I have you, Van, Casey, Kristen, and Angela. Did I miss any other TAC members?
No, that's five. So six is a quorum or seven?
Hold on. You have 11, so you need
Okay.
so 6. Yes, sorry.
Okay, so we're not counting the vacant spot.
No, because it's actually vacant and not a
Okay.
inactive member.
All right, just checking. All right, very good. All right, so after the quorum, we will not do the minutes. Let's go on to then the agenda. And the first topic will be a DMS update. I have Leslie Hoffman, but I don't know if it's Leslie, but I'm sure we'll get a DMS update.
I believe Angela's here on behalf of Leslie today.
Okay.
Yes, thank you, Aaron and Steve. Leslie is attending a judicial workshop outside of the state, so she wasn't able to be with us today. So do want to provide some updates, and again, if it's okay, Steve, we can jump into the section 1115 reentry opportunity updates for everybody today.
Yep.
So I think again in our last in the last TAC meeting, we were getting ready and again preparing individuals that we would be reaching out to conduct stakeholder interviews around again the reentry demonstration opportunity. What changes again we would need to make to the pending application with CMS, and help kind of guide the next steps from there. So following that, the last TAC meeting, again, the department did conduct stakeholder interviews. Those included our sister agencies, our managed care partners. It also included representatives from various TAC committees as well, advocates and consumers. were a part of those interviews. And so again, they did assist the department in capturing the current state of procedures across the state. Again, included the efforts among various agencies and partners. Again, we were also able to capture the procedures that an individual from the time of incarceration through their release and thereafter undergo. And so again, that really helped us better understand current state. We know, again, since our initial submission to CMS, opportunities had changed, as well as, again, procedures that we had initially captured, efforts that were going on. So again, it was really helpful to bring everyone back together and capture where we are today. The interviews
Angela, did
again,
any members of this TAC participated? I filled in and never heard back for the interview.
yes.
Okay.
Yes, there was a representative from the TAC, as well as, again, there were advocate groups in that interview and individuals with lived experience as well. So again, we received great feedback, especially, again, it was very helpful and very appreciative for those individuals to share their stories. And it's valuable feedback and will be going forward. So. Yes, I think, again, some of that will be captured, Steve, in the application, and we'll talk about that. But again, the interviews did help. We were able to across the state and agencies look at and capture where there are gaps, barriers, and challenges. Certainly, as we all know. But again, it also helped us identify where there are strengths to leverage. What is the current infrastructure that we can build upon through the agencies and communities? And so again, there was a lot of great information from that. So those interviews were wrapped up, I believe, end of September, early October. Again, we did work to compile that and have been working on drafting an application to submit to CMS. And so the application, again, was taking into consideration feedback from the interviews, again, the state Medicaid director's letter that was issued earlier this year, as we've spoke to several times, as well as CMS feedback and discussion to states, as well as other conversations and discussions with other states, legislative requirements, and again, trying to consider how we can best meet the needs at hand, and then again, within a timely approval so that we can begin implement the demonstration, be able to build and expand throughout and as we move forward. And so with that being said, do want to provide some updates. We'll talk about the public comment period. But again, in that public comment period, you would expect to see the request will include, again, coverage for certain services for the adult population in state prisons and for our youth, in our youth development centers under DJJ custody. And the services, again, to be requested will include case management services 60 days prior to release, or up to 60 days prior to release. Again, there are several barriers in identifying when that release date may occur. And then again, those individuals will also receive case management services 12 months post-release, or be eligible to receive case management services 12 months post-release. The again, MAT services, including medication and the therapies, would be offered and eligible to individuals 60 days prior to release for those in both our prisons and our youth development centers with an SUD diagnosis, and would meet qualifications for those services. The individuals, again, would also receive a 30-day supply of medications at the time of release. And so those, again, would be available to them. And then an additional service that we are looking at and will be requesting is a recovery resident support service. It would be provided by eligible recovery residence providers. And that would be available to individuals that are in the reentry population, and those that are also participating in the Senate Bill 90 program, the behavioral health conditional dismissal program. And for those individuals, again, with that SUD diagnosis that would meet qualifications for that service, and then they would be eligible for that again up to 3 months post-release, or again as a part of the Senate Bill 90.
And what would those services be? Recovery residential support services?
They again, it would be provided by an eligible recovery residence provider. It would be to again, as we've stated, Medicaid, we cannot reimburse for housing. So it would not be reimbursing for the housing component of recovery housing. It would be, again, a mechanism to provide a reimbursement, seek reimbursement for the supportive services that the individual does receive while they are residing in a recovery residence program. Again, the services would be including assisting the individual, the recovery housing staff, appropriate recovery housing staff, assisting the individual in developing a recovery management plan, identifying their recovery capital needs, helping again through those assessments. Again, lots of care coordination, identifying those and assisting. And again, there's going to be some overlapping with the case management services for our reentry population that we will have to work through in implementation planning and have discussions with. But again, helping them stay connected to the community, identify those needs and resources. Again, those services that are provided within the recovery residence.
Angela, this is Stephanie from United. When you say community support services, are we creating new services, or what service codes that we're looking at as, to Steve's point, supporting the recovery housing efforts? I mean, is this psychoeducational? Is this?
No, so the Recovery Resident Support Service, and we'll refer to it as RRSS. The RRSS service, again, we would be developing a new procedure, billing procedure code for that. It would be a new service. Again, it's a non-clinical service, and it would be by the support, the paraprofessionals and support staff within the recovery residents that can provide the service. But the recovery resident, as they would be enroll and would enroll as the provider, as a new provider, not necessarily a new provider type. Again, that's through the implementation phase and planning. We will need to discuss on that they would actually enroll with Medicaid as a provider.
Okay, and that is helpful. Is there a specific certification that goes with that paraprofessional or training similar to other support or paraprofessional certifications?
Again, it would be, the services are typically in the recovery residence provided by peer support. So again, they would be expected to meet the peer support certification requirements and training that we have currently today. And then again,
so these are going to be peer support specialists, we're thinking?
Yes.
Okay.
Typically, those are the individuals that would be providing those services in these residents. And again, the residents would have to meet certain qualifications as well, such as NARS certification and so forth. And
hi, Angela.
Go ahead, sir.
This is David from Anthem. Which type of peer supports, the SMI or SUD or both?
Again, this would be individuals with SUD that would qualify for the service, so they would need to have that that lived experience and support.
Yeah.
Mhm.
Thanks, Angela. This is helpful.
You're welcome. And again, the RRSS service, you know, there will be discussion with CMS as to it may not necessarily fall under the reentry demonstration. It may fall under the broader Team Kentucky and SUD, as this service would be specific to SUD. Those under the reentry again are not all specific to SUD. So that again will be in conversations and negotiations with CMS and guidance from them as to where that service will technically fall. But again, there are legislative initiatives as well to meet, and that service will assist in doing that. We do anticipate going to public comment period and posting the draft of the application for public view and comment by the end of the week. And so again, I wanted to provide the update here today and let everyone be aware to expect that by the end of the week. So we will send out an email notification when it is officially posted to the website with the information where to find that, and Steve will send that to you, and you can certainly send that out to the TAC members. If you would like a direct email notification as well, feel free to include your email in the chat box, and we'll capture that and add you to the mailing distribution list when we get that notification out to everyone. But again, just want you to be aware that that is forthcoming very soon. With that being said, let me pull up here. We will have 2 public forums that will be held to review the application with the public, and that is going to be Monday, November 27th at 10:30 to 12 p.m. Eastern time, and Friday, December 1st from 2 to 3:30 Eastern time. And again, all of this information will be posted to the website. The invitation and how to join those meetings will be there as well. And again, we will send out the notification to the TACs, who can also distribute the information. And so you'll have that also, but want to go ahead and give that. The public comment period would expect to run through December 9th. It's a 30-day public comment period. The department then will review public comments, incorporate changes and considerations, any changes that we feel like we would need to make to the application prior to submission to CMS by the end of the year. So that again is what you can expect to see. We do hope that you will take the opportunity to review the application and the request as we get it posted.
Yeah, this is kind of big news, isn't it? I mean, we're tangible progress, right?
It is. It's exciting. Again, it's a great opportunity for states. I think again, hopefully in the application, you know, you will see that there's lots of consideration into the you know, where we have come. And so again, I think based on guidance, we are really looking to we want the demonstration to be successful. We want to be able to get it off the ground, and we want to be able to do that timely. And so, you know, I think again, there is going to be amendments to that. CMS has even discussed with states again, essentially get the foot in the door to begin with. And then we will work on changing and improving, expanding as we go. So again, additional populations, additional settings, additional services can be added at a later time, especially as we work through the planning, implementation planning. But there are budget neutrality considerations and the reinvestment plan consideration, which is new to states under this demonstration. So and again, there's readiness assessments that all facilities that would participate in the program have to undergo. So for all of the services that are requested and approved in the demonstration package, all facilities have to ensure that they have access and can provide those services. So the more services we add under the package, again, we have to ensure all facilities can meet that. So we do want to, again, have a starting point and build and grow upon that. But again, ensure that we can be successful in doing that in the beginning. Another thing that I didn't mention, and I do want to say, in addition to the public notice, also expect some of you will probably receive and should receive an invitation. We will develop an advisory council made up again of our state agencies, community partners, individuals with lived experience to help guide our implementation planning and process. And so again, there will be some invitations being sent to join and participate in that advisory council. And so again, you should expect that fairly soon. And we'll talk about a kickoff plan for that council and what that will look like over the next couple months or into the first of the year. Any questions?
Any questions for
at
Angela?
this time?
I mean, this TAC was really formed to be involved in this process way back when. So I think it's exciting for us to be in a position to do that, right? And I think it's a topic many folks have talked about over the years of, people coming out kind of fall through the cracks, or someone once told me it's hardly a crack, fall in a big hole and never really get out of that. And there's an opportunity to at least move forward, right? And figure that out. I like the idea that it's, I always think it's better when initiatives are kind of made of rubber instead of steel, give you flexibility to make some changes and add some things going forward. So we appreciate the work you've all done to get us to this place and look forward to reading it. And public comment period, 30 days, and it varies on what happens. Sometimes there's a lot of comments and sometimes there's not many. But those, at least will be reviewed and considered by Medicaid staff and then be incorporated. Some may be into the final present, application to CMS, which we hope to get done by December, right? Pretty quick turnaround.
That's correct. It is. I know again, we do have some initiatives to meet as well. So by the end of the year, I will also just want to, while we do have the opportunity, ensure that everyone also understands the process. So once we do submit to CMS, we can expect that they will also go to a 30-day federal comment period as well prior to them beginning to review the application. And so we do have to keep in mind that obviously, we don't know the time frame that it would take for the state to receive approval. But again, we hope that what we're proposing and requesting initially will be a more speedy, quicker approval to get started and have really stayed within the parameters of their guidance and requirements. And so with that being said, even when the state does receive approval, that does not mean it's go live. We can begin providing services, receiving the funding. So with that being said, again, the state at that point then does have to submit a implementation plan that has to be then approved by CMS as well. Once CMS approves that implementation plan, which is our full detailed plan on how we're going to meet the milestones and implement, that again, once that's approved, there is a go live, and we're eligible to receive the authority and draw the federal match for those services. So I just want to make sure again that everyone is aware for even the RRSS service mentioned, and the reentry demonstration opportunity, that should we receive even approval within a few months, that's not a go live. So,
Right.
which isn't meant to be said as discouraging. Just want to make sure everybody's aware of the process. And the again, advisory council, there's lots of work that we can do prior to approval to work towards that. When we do have the approval, we can have a more timely submission of the implementation plan.
All right. Very good.
Not a question, Steve, but a comment. DMS
Yeah.
has done a tremendous amount of work on this, well, all the way back to 2020. I know this has to be frustrating for a lot of folks because we did all that work in 2020 and responded to questions from CMS and public comment, and then have to start all over again. But a lot of work has gone into this from Angela and Leslie and Leanne and others to get us to this point.
Yeah, we appreciate that. This is, as we understand, we said before, Kentucky was the first one to submit it, right?
Right.
And then we won't debate what happened, and this application that, proposal is everything CMS has approved already in other places. Other states have similar plans.
Yes, there's 2 other states that have been approved, and again, their application approved. They're not in their
Right.
implementation plans have not been approved.
Yeah.
2 other states, well, and actually a third may have just been added, Steve.
I think
may have
so.
missed one.
I saw Michigan.
Yeah. And so with that being said, again, we have to also remember that some of the other states have requested additional services or other settings and so forth, or phase in, and again, their reinvestment and their capacity building funds is again very broad, and as well. So those are things to definitely keep in consideration. And that was guidance from CMS to kind of look at not necessarily their exact services or again settings, but again how they stayed in the parameters of the state Medicaid director's letter. So
Yeah. I asked that because that should help with approval, I would think. We're not doing something that is new to them.
yes, and again, they have even in conversation with one of the states, have acknowledged they're going to have to go back and make some changes. Even so, based on some of the guidance that came out from CMS after that. So even those initial states are, again, it's going to be an amending and changing and expanding as we move forward. So, and again, we do acknowledge that the request may look different than the original request. Time has, certainly a lot has changed in the needs in the last 3 years, and we do have an opportunity, to expand coverage to additional populations and so forth. So we do have a great opportunity ahead of us, and we appreciate the support and input. So I do want to, with that being said, sorry, one more thing I do want to mention to the group that you might see in the application, and not to again be to be alarmed. We are going to officially withdraw the pending original incarceration amendment. And then with this request, officially request the full reentry demonstration opportunity that CMS provided to states. And the reason being is because the original was specific to our SUD 1115. It was an amendment to our SUD 1115 demonstration. And at this time, it will not be specific to SUD for all of those services and populations. So again, after discussions with them, it will just officially withdraw that. It doesn't mean that's not going to, hurt the state in any reason, put us down on a list at all as far as review, anything like that. It's just, again, it's the authority that was originally requested and how it's changed and evolved since then.
And also the youth and DJJ is a new piece, right? Initially, that was going to be kind of phase 2.
It is, yes,
But
correct.
I think it's based on what's been taking place, it's a good action, right?
Correct.
Any other questions? And Aaron, I understand. Thank you, Angela. It was good information, as always. We have a quorum now. Is that
Yes,
true?
sir.
All right.
Kevin joined, if he's still with us.
Kevin, you out there?
Yes, I'm still.
All right. So let's go ahead. Minutes been gone out. Take a look, and to vote, you have to be on camera. There we go. Christian Porter, fine job. Some people are driving, so set them out. Do we have a motion to approve the minutes?
So moved.
Thank you, Van Ingram. And a second?
I'll second.
Thank you, Angela. All in favor, say saying aye.
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 Opposed and abstentions. All right, adopted. Good deal. That's kind of a procedural thing we have to do. Anything else for Medicaid? I think that's a good report. Appreciate that. Okay. Next item, I added this Medicaid billing for clients referred by Department of Corrections. I have heard that one of the centers has been told by DOC, Department of Corrections folks in their region, to make sure they bill corrections for services, even if the person is Medicaid eligible. And what came up on this issue, this is one of the 4 certified community behavioral health clinics. They're in a demonstration project. And no one else has heard this. I confirmed it again today to make sure my hearing was correct previously. And really what happens is, I know Medicaid's the payer of last resort, but these folks are Medicaid eligible. And it appears to be a data issue as much as anything. So corrections has data on services received by folks who have been, well, essentially probably covered with this waiver going forward. And I just want to, let Christian Porter, I sent it to her as well, or other folks at DOC take a look at it. And the CCBAC came up because their reimbursement methodology is a little bit different than other providers, that they get a set daily rate regardless of the service. And Medicaid makes a RAT payment from the established fee for that service up to this daily rate, and this center is not getting that RAT payment. So I think if this is going on, I think we need to figure out a way to make sure corrections gets the needed data. And they said, we'll do whatever to get them the data, but we'd like to be able to continue the relationship with these folks who are Medicaid eligible, have a card, doing everything we want to have happen going forward with this. And then this just came up, and it may be it may be staff at this center is misunderstood, but it appears to be as much data-driven issue as actually, the process of services and billing and all that stuff.
Yeah, Steve, I was definitely interested when you said that. And I apologize to the group. I have to be on the road today, so that's why I'm not really on camera. But if you could connect me with who exactly was saying that, so I could get some more details, because I have asked around to the different entities in DOC, and what I am being told is we do not reimburse the CMHCs.
Well,
So I'm
good.
I'm confused
Yeah.
as to what I think the staff there might be confused because DOC has never reimbursed CMHCs.
Right.
So I think they may be confused, but I would love to clear it up. So
All right. I will do that.
okay, awesome.
Good. Just, on topic. All right. Next are MCO updates. Etna. Maybe not on. Anthem, David Crowley, how are you?
Hey, Steve. Good morning. Good morning to the TAC. Anthem updates. We continue to have very few referrals each quarter. I think we've had 3 since our last meeting. We were able to engage those 3 referrals with our dedicated case management outreach. So that's nice to hear. We've been increasing some of our QPR trainings out in the community. You might have seen some advertisements for that. And QPR is a question, persuade, and refer. It's kind of a layperson type of education and intervention for suicide prevention. A lot of that not necessarily geared toward corrections, but certainly suicide prevention in the community. That's all for Anthem.
Okay. Thank you. Etna's here. They couldn't unmute, so maybe they can submit something in writing. Can you unmute now?
Yes, I'm here.
good.
This is Lana. I apologize. So we are working on building, connecting with the inpatient programs to try to connect with the members and enroll them in case management. We're also looking at the VABs, the value added benefits. We have some funding that we use for bus passes and things like that. And we're kind of looking at maybe some other possibilities. I'm also going to be attending a expungement clinic in December. So we're doing some outreaches and that's it.
Okay. Thank you.
Thank you.
Humana?
Hey Steve, this is Jeff Hadley with Humana.
Yeah, how are you?
Doing fantastic. Yeah, we did want to report out that we have seen a substantial decrease in our members being released through the reentry program. We've only had 2 that were released since September, since our September TAC. We did want to give some recognition to Avery Bilbrey, who's a reentry coordinator, for helping to facilitate a connection with our care managers with one of our members that had been unable to make the appropriate contacts. And so Avery, we just wanted to express our appreciation for Avery for helping to facilitate that. And then as far as activities go, we, kind of polled our community engagement folks on activities that have been beneficial for us to connect with folks, and just wanted to I think notify the TAC that we've experienced some success with like Life Learning Center up in Northern Kentucky. They have a monthly core connection resource fair that has that's been a good process for us to connect with those individuals. The second chance days through Goodwill's been a great partner with us through their resource fairs and the second chance days that were through Goodwill in Western Kentucky and in Central Kentucky. The Lexington Opportunity Center has second chance days that have produced pretty good results for us as far as outreach opportunities for those folks reentering. We do have a representative that's a member of the Western Kentucky Reentry Council, and they do expungement clinics among other activities. That's been a good resource for us. as well as just connecting with the reentry coordinator department. We've got one rep that has regular contact with that department, and they host reentry events. Specifically, we've done stuff in Scott County, Nicholasville area. So we just really wanted to report out on where we are seeing some success in our outreach opportunities and ways to engage members and those folks that are eligible, and just basically providing opportunities to educate those folks and to connect them with those resources. So that's our update.
Thank you. Passport.
This is Mark Zockham. I'm presenting on behalf of our community engagement team. We've about finished our Q4 expungement clinics at our offices throughout the state. As of today, we've had 189 individuals who we've served at the clinics. We have also provided a couple of clinics, not in the offices, but with community partners in a couple of counties. Our Owensboro expungement clinic is scheduled for November 14th. We also have a follow-up meeting scheduled with DOC to discuss our presence in some of the targeted prisons that we'll be working in. And I think our numbers from releases has been pretty steady, about 3 or 4 a month. And that's my report for Passport.
Thank you. Where am I here? United.
Hey, good morning, Steve. I am on the road as well, so hold on. I'm pulling over to give you our update. Similar to all the other MCOs, pretty low referrals. Year to date, 15 members have been released. There was 9 unable to contact and 2 have refused services. 1 was reincarcerated, and then we've actually been working with 11 since the last TAC. There was 5 released, none last month in October. We're currently actively working with 3. So similar to the other MCOs. Also like to just kind of show some success with our partnership also with Goodwill and the health fairs. There was an expungement clinic back in August and another one for November that is upcoming right before Thanksgiving. We are looking at potential opportunities internally to enhance some of our reporting to identify these members through the eligibility to see if we show any more successes. So that is where we are to date, Steve. Anything else from my clinical manager, Liz, that's on the call that you would like to report out on?
Yeah, no, nothing from me, Stephanie. Thanks.
Okay.
Great. Thank you.
Thanks.
And there's Stuart Owen, Prep for WellCare.
There's Stuart Owen. Good morning, Steve. And I want to say I'm impressed. I think Kristen and Stephanie both on the road and participating, dialing into the call. That's, I'm impressed by that. I just want to say that. I know that's a challenge. You're more talented than I am. A couple things with WellCare. One thing that I just recently learned about, and I'll give a little background. I hope I'm not boring, but we created these community impact councils, which are literally, we identify civic leaders in different communities, and it's basically driven by our social determinants of health database. We have it broken down by county. And so we will target needs in given communities and create these councils where we identify civic leaders, community leaders, get them all together, talk about, a couple goals, mission, and brainstorm, collaborate, and try to get outcomes. Well, anyway, I just learned about a week ago, we have one for re-entry. And Alicia Smith, and I forgot to forward the invite to her, is absolutely awesome. She is the one that's set it all up for WellCare. And so the next meeting, and I'll put it in the chat as well, is January the 8th. in Frankfurt at 11 a.m. at the administrative office of the courts. And I know we got Senator Reginald Thomas from Lexington is going to be there, and there's a lot of different people from there. And she's had several of these council meetings already. So that's the next one. So just really excited about that. And then also we have our senior behavioral health director, Paula McFall, who's got a couple of things I think she's going to talk about as well. So I'll hand it off to Paula.
Yes. I think the last meeting we talked a little bit about our partnership with Wayspring, who is like an extension of our care management program, who can go out into the field and meet members specifically with SUD needs. But they also provide some services for other health needs. They have 3 clinics across Kentucky. We met with Wayspring and the Department of Corrections regional managers on Monday this week to talk through how Wayspring might be able to help with reentry. We met with Matt Aaron and Katie Green, and the person with Waysprings, her name is Christy Dixon, who will be meeting these members, and we'll try to coordinate. Katie and Matt will kind of help Christy know who to connect with at the facilities so that she can maybe meet these folks before they're leaving prison to assist with SDOH needs, appointment needs, service needs. So that is exciting. Again, we have a very low volume, but we're hopeful Christy can get in and help some of these members. And we went through all the counties that Waysprings manages with them. And so we have all of the prisons and jails that we can work with. So that's the update.
All right, thank you. And just so folks know, the Impact Council, the reentry one that was posted in the comments, and those are open, Stuart?
Yes, they're open. Please, totally welcome. We want everyone's input. So definitely open to the public.
All right, thank you. Any questions to the MCOs, folks? All right. Round robin member updates. I've included Medicaid eligibility post-release because I still hear reports, it takes some folks longer to get that done, and there are some hiccups. I just think it's something we need to pay attention to. And again, the 1115 SUD waiver should really solve that problem, right? We would hope for most folks, but we're still occasionally people show up and they think they've done everything and then they find out they're not eligible. But doesn't happen nearly as much, but I always ask at our monthly CART meeting, and regularly, we get 1 or 2 reports that there's some people who are not, they think they are, and then some reason there's a hiccup, provide services. So I just think we need to keep paying attention to that, and hopefully it gets fixed over time. So.
Steve, and thanks for mentioning that. And I'll just also say, yes, and I think that that's one thing we've discussed. There's lots of needs, right? But if anything out of the waiver opportunity that we can really improve the reinstatement of eligibility for the individuals, because again, that's really where the breakdown certainly causes several barriers and challengings. That's going to be very successful. And so just again to kind of elaborate on what was mentioned earlier, in the request, as we've said, this is a starting point. And so when we again get into the implementation planning, it's one thing that's going to be very critical for the state and our partners to be able to demonstrate to CMS for an approval, is that we really have the ability in our systems and integrated to be able to, for the folks that are covered under the demonstration, be able to reinstate those benefits at the time period that we request under the demonstration. But by doing that, that gives us the opportunity, even for the settings such as the county jails, that aren't initially requested to be covered, that still gives us an opportunity when we're building and looking at these system changes to be able to to make those changes. It's not necessarily, we can't reinstate necessarily the coverage of those individuals in those settings pre-release, but really it gives us the opportunity as we're building this to go ahead and initiate some of those changes so that when that individual at the time of release, we have that system and infrastructure already there and built. So I think that's, again, just something that we want to keep in mind, that it's still this is still a great opportunity when we discuss, and that's what we, again, really mean to expand and as we move along. But when we really get into the implementation phases and discuss these system changes, there are opportunities that we can, make the changes outside of what is just required or requested in the demonstration.
And I hadn't thought that. I'll ask next time this comes up, were those folks released from a DOC facility or a local jail? Because that could impact the process as well. Right.
Right. And so I think in our planning, those are all the things that we want to capture, that it, down the road, right, that we already have plans and thoughts and an infrastructure on how to address some of those issues. So I just wanted to mention that.
All right, very good. All right, round robin, other things, other folks, questions, concerns, or just reports you want to provide? All right. Hearing none, I always have future agenda items. Of course, I said this when we started this, and I would chair for a year. So if anyone else wants to step up and be the chair, now is the time.
You're doing a great job, Steve.
Yeah, I figured that was always the report. So that's all right. Just put it out there just in case somebody wants to do this.
Nice try, Steve.
Hey, well, nothing gained, right? Don't ask, you know where. But anyway, last item is just the January dates, maintaining the second Thursday of the month, and go on from there. All right. Thank you all. Appreciate it. Talk to you all in January. See you. Bye-bye.
Thank you. Have a good one.
Thank you.
Thank you, Aaron.